Hi, my name is Isabelle Germano. I'm the past president of the NS CNS section on tumors. I am thrilled to share with you the journal highlights of our recent work titled NS CNS section on tumor guidelines, assessing their impact on brain tumor clinical practice. I'd like to acknowledge all the co-authors of this work listed on the slide, and in particular, Faith Robertson, neurosurgery resident, who served as CNS quality and guidelines scholar. Clinical practice guidelines, as defined by the National Academy of Medicine, are recommendations intended to optimize patient care that are informed by a systematic review of evidence and evaluation of the benefits and harms of alternative care options. Within neurosurgery, clinical practice guidelines development is championed by the Congress of Neurological Surgeons, the CNS, which has funded, supported, and developed over 23 guidelines, all of which are freely available to neurosurgeons worldwide on the CNS app, the CNS web, and are viewed over 1,000 times per month. As the NS CNS section on tumor marks its 40th anniversary in 2024, the aim of our study is to reflect on the tumor guidelines that have been established over the past 10 years and explore their impact on publications, patents, online engagement, and information dissemination to the public. Our methodology focused on selecting the tumor guidelines published over the past decade on the 6 tumor topics listed on the slide. Measurement of impact data was done using 5 sources: the citation count on PubMed Google Scholar, altmetric dimension, Mendeley score, news, patent policy publications, and website visit to the CNS landing page for each guideline. The bar graph in the figure summarizes the overall impact per year of each tumor guideline, normalized by month since its publication. It is worth noticing that the highest overall score was achieved by the non-functioning pituitary adenoma guidelines. Of note, these guidelines are multidisciplinary, involving many broad-based specialties, including endocrinology and ophthalmology. Another highlight is the fact that in the most 3 recent guidelines, the Twitter X score is higher than in year past. When we looked into the glioma guidelines, the low-grade glioma published in 2015 had the largest citation and engagement score, with an annual publication citation of 24.5 on PubMed and 65.4 on Google Scholar, altmetric dimension of 52. It also led with Mendeley reads per year and 1.5 incidents of news, patents, and policy publication per year. Within the non-glioma guidelines, the metastatic brain tumor guidelines published in 2019 had the overall greatest number of citation on PubMed and Google Scholar. These were related to the topics of surgery, followed by stereotactic radiosurgery. This guideline also had the highest CNS website visits, with a total of nearly 30,000 visits. In conclusion, clinical practice guidelines serve as a beacon for providers, leading them to implement evidence-based care to optimize patient outcomes. Creating impactful guidelines means that the healthcare provider both are aware of the information and feel that they can turn to these documents for guidance and trust that the information provided is sound. Therefore, the impact extends beyond citations, as demonstrated by the nearly 30,000 visits to the brain metastatic guidelines, which are not fully reflected in peer-reviewed citation scores. Through a multi-dimensional assessment of impact, we garner a better understanding of which guidelines are most accessed and used, along with the where and how. Additionally, our work allows us to identify room for improvement in leveraging social media distribution and incorporation of news and international guidelines adoptions. As social media grows as a method of information exchange, broadcasting previously published or new guidelines can help spread awareness. We hope that our work will inspire other joint sections to examine the impact of their guidelines. We wish to thank all the neurosurgeons and other physicians that work really hard volunteering to prepare the guidelines and or serving on the Joint Guideline Review Committee. And naturally, we're very grateful and thankful to the CNS and CNS staff for their outstanding support. Thank you for your attention.